Hey everyone, and welcome back to KenkoVibe, your daily dose of health insights. I'm Ethan Reed.
And I'm Grace Morgan.
And we're diving into a topic today that we often hear whispers about,
Yeah.
but rarely discuss openly: erectile dysfunction after prostate surgery.
It's definitely a sensitive topic,
It is.
but an incredibly important one.
Yeah.
Especially considering how common prostate cancer is these days.
So let's get right to it. We know the prostate is involved in,
Right.
well, male reproductive health.
Mm-hmm.
But how does surgery to remove it lead to ED?
Yeah,
Can't be that simple, right?
you're right. It's not simple at all. Think of it this way. The prostate is like a neighbor
Okay.
living a little too close to some very important nerves.
Right.
These nerves are responsible for triggering erections.
Okay.
When surgeons remove the prostate, there's a risk of damaging or even severing those nerves.
So it's like collateral damage during the main event, which
Exactly.
is removing the cancerous prostate.
Exactly. And that nerve damage is what often leads to ED. It's like the communication lines between the brain and the penis get disrupted.
Wow, I never thought of it that way.
Yeah.
So even if the surgery is successful in removing the cancer, there's still a chance of this pretty significant side effect.
Absolutely.
That must be a tough pill to swallow.
It is. It's a major life adjustment.
Yeah.
And that's why surgeons try to use a technique called nerve-sparing prostatectomy.
Okay.
It's all about trying to preserve those delicate nerves.
Okay. That sounds promising. Does that mean guys who have this nerve-sparing surgery are in the clear?
Unfortunately, it's not always a guarantee.
Right.
Even with the most skilled surgeon, there's still a chance of nerve damage,
Okay.
especially if the cancer is close to those nerves.
I see. So what happens then? How long does it typically take to recover from ED after surgery?
Well, it really depends on the extent of the nerve damage and individual factors,
Sure.
like age and overall health.
Okay.
Many men experience ED immediately after surgery. It's almost universal.
Really?
But think of it like any other injury, it takes time to heal.
Okay, so there's hope for improvement,
Yeah.
which is reassuring.
Absolutely.
But how long are we talking about here? Weeks? Months?
Think more like months and even years.
Yeah.
Many men see significant improvement within a year.
Okay.
Some it might take up to 2 years
2 years.
for things to return to, let's say, normal.
Wow, that's a long time to deal with this issue.
Uh,
Are there things men can do to speed up the recovery process?
Absolutely. That's where penile rehabilitation comes in.
Rehab. Okay, I think we need to unpack this.
Mm.
What does that even entail?
It's kind of like physical therapy.
Oh.
But for the goal is to keep those blood vessels in the penis active and healthy.
Okay.
Imagine you have a muscle you haven't used in a while.
Yeah.
It gets stiff and weak, right?
Yeah.
Penile rehab is about getting things moving again.
So are we talking about like specific exercises?
Yes, exactly. Doctors might recommend things like using a vacuum device to help draw blood into the penis,
Okay.
or even scheduling erection appointments a couple of times a week.
Wait, hold on. Erection appointments? You mean like setting aside time to, well,
Yep, pretty much.
wow.
It sounds a little strange, but the idea is to encourage blood flow and retrain those nerves. Think of it like sending signals down those communication lines we talked about earlier.
Okay, I'm starting to get it.
Yeah.
So it's all about actively working towards recovery,
Right.
not just waiting and hoping for the best. And I guess medication can play a role too,
Well,
right?
absolutely. Medications can help improve blood flow
Right.
and make it easier to achieve an erection, especially in those early stages of recovery.
So penile rehab and medication are the first lines of defense.
Mm-hmm.
But what happens if those approaches don't work as well as hoped?
Yeah.
What are the other options?
Well, there are other treatments available, like penile injections.
Injections.
Yeah.
Straight into the, that doesn't sound very appealing.
I get it. It can seem intimidating at first.
Yeah.
But it's actually a very effective method.
Yeah.
The medication goes directly to where it's needed, bypassing the nerves entirely. And it's not as bad as it sounds, really. Doctors will teach you the proper technique.
Okay. I'm glad to hear that. Are there any other alternatives to injections?
There are. Some men find success with urethral pellets, which are small, dissolvable medications inserted into the tip of the penis.
That sounds a little less scary than injections.
Yeah.
Are they as effective?
They can be for some men,
Okay.
but they tend to be less reliable than injections.
Okay, so we've got rehab, medication, injections, and pellets. Are there any other options on the table if those don't do the trick?
Well, there's one more option, but it's generally considered a last resort. Surgical implants.
Implants. Whoa, hold on a second. We're talking about something implanted inside the, you know what, let's say this conversation for part 2. It seems like a pretty big topic to tackle in the last few minutes.
You got it. It's definitely a topic that deserves its own segment. We'll be back after a short break to discuss surgical implants and the emotional side of dealing with ED after prostate surgery.
Yeah. All right, so before the break, we were getting into some, let's say, more involved treatment options for ED after prostate surgery.
Right.
You mentioned surgical implants. What exactly does that involve?
Well, think of it as kind of a bypass solution. Remember those nerves we talked about?
Huh?
The ones that can get damaged during prostate surgery?
Right.
Implants essentially circumvent those nerves altogether.
Okay, so it's like creating a whole new pathway
Yes.
for achieving an erection.
Exactly. There are a few different types of implants,
Okay.
but the most common ones are inflatable. Imagine 2 tiny flexible cylinders surgically placed inside the penis.
Inside the penis. Wow, that sounds intense.
It is a surgical procedure,
Yeah.
so it's not something to be taken lightly, but for men who haven't found success with other treatments, it can be a game changer.
So how do these inflatable implants actually work? Is there like a button you press?
Not quite a button, but it's pretty ingenious. Along with the cylinders, there's a small pump implanted in the scrotum
Okay.
and a reservoir of fluid implanted in the abdomen. When a man wants to achieve an erection, he uses the pump to move fluid from the reservoir into the cylinders, causing them to expand.
So it's like manually inflating the cylinders
Yes,
to create an erection?
precisely. And when he's finished, there's a release valve on the pump to return the fluid to the reservoir, and the penis returns to a flaccid state.
Wow, that's pretty high tech. Are there any downsides to this type of implant?
Well, like any surgery, there are potential risks,
Yeah, right.
such as infection or mechanical issues with the implant itself. And it does require a bit of, let's say, finesse to learn how to use the pump effectively. But for many men, the benefits outweigh the risks.
That makes sense.
Ah.
You mentioned there are other types of implants. What are those like?
There are also semi-rigid implants, which are essentially permanently firm rods implanted in the penis.
Okay.
They're a simpler design, but some men find them less comfortable because they don't have that natural flaccid state.
So it's a trade-off.
Yeah.
A simpler design, but potentially less comfortable. I imagine the choice depends a lot on the individual's needs and preferences.
Absolutely. That's why it's so important to have open and honest conversations with your doctor to figure out the best approach.
It seems like with all these options, from penile rehab to medication to implants, there's a good chance of finding a solution that works.
Mm-hmm.
But I imagine the emotional side of dealing with ED can be just as challenging as the physical aspect.
You're absolutely right. ED can take a toll on a man's self-esteem and relationships.
Yeah.
It's important to remember that it's not a sign of weakness or something to be ashamed of.
It would be incredibly frustrating to go through something like this.
Yeah.
Especially after already dealing with the stress of cancer and surgery.
Exactly. And that's why seeking support is so important. Talking to a therapist specializing in sexual health can make a world of difference.
What kind of things do those therapists help with?
They can provide coping strategies, address any relationship issues that might be arising, and help men reframe their thinking about intimacy and sexuality.
So it's not just about fixing the physical problem,
Right.
but also addressing the mental and emotional impact.
Right. Precisely. It's about approaching the whole person, not just the symptoms. And often partners benefit from being involved in therapy as well.
That makes sense. Communication and support from loved ones are so crucial during challenging times.
Absolutely. Open communication is key. It can help partners understand what each other is going through and find ways to maintain intimacy, even if things look a little different than they used to.
It sounds like there's a lot to unpack when it comes to the emotional side of ED.
Mm-hmm.
But I think the main takeaway is that there's hope.
Yes,
There are resources available,
absolutely.
and it's okay to ask for help.
I couldn't agree more. ED after prostate surgery doesn't have to be a life sentence. With the right treatments and support, men can regain their confidence and enjoy fulfilling lives, both physically and emotionally.
That's a powerful message. And speaking of powerful messages, it seems like we've covered a lot of ground today. Any final thoughts before we wrap things up?
Yeah, you've given us a lot to think about today, Grace. And, it's clear that this isn't just about finding the right physical treatment. Exactly. It's about understanding the emotional and psychological layers, too. It's about open communication, patience, and a willingness to adapt.
And I think it's also about recognizing that intimacy can take many forms. It doesn't always have to be centered around intercourse.
That's such an important point. There are so many ways to be intimate with a partner, cuddling, massage, even just talking and connecting on an emotional level.
Absolutely.
Yeah?
It's about finding what works for you and your partner and remembering that Intimacy can evolve over time.
And speaking of evolving, I think it's important to remember that recovery from prostate surgery and ED isn't a linear process. There will be ups and downs and setbacks along the way.
That's true. It's like any healing journey. There are going to be good days and bad days, but it's important to stay positive and focus on the progress you're making, even if it's slow.
Exactly. Celebrate the small victories and remember that you're not alone in this. There are support groups, online communities, and therapists who specialize in helping men navigate this challenge.
And, of course, your doctor is a valuable resource. Throughout this journey, they can answer your questions, address your concerns, and guide you towards the best treatment options.
Absolutely. So to all the men out there who are listening and going through this, remember, you're not defined by ED. It doesn't have to control your life or your relationships.
Well said, Grace. And to wrap things up, I just want to echo that sentiment. There is hope, there is help, and there is life after prostate surgery.
Don't be afraid to reach out for support, explore the resources available, and remember that you deserve to live a fulfilling and satisfying life.
Thank you so much for joining us today on KenkoVibe.
We hope this deep dive into erectile dysfunction after prostate surgery has been informative and empowering.
I'm Ethan Reed.
And I'm Grace Morgan.
Don't forget to subscribe, like, comment, and share this episode with anyone who might benefit from this information.
Stay healthy, stay informed, and we'll see you next time for another deep dive into the world of health and wellness.